had the first one in January, and this is the second one of 2017 on the topic of housing. I guess before we delve in, as usual, our city communications office will be live tweeting this from the @KCMO Twitter handle using the hashtag KCStat. So you can follow along there and also ask any questions that may come up.
Before we get started, do you guys have this presentation on in a PDF form?
Yes, we do, online.
Can you send it to me again right now, please?
Sure.
Mine is corrupted for some reason.
Okay.
SJ at KCMO. Go ahead, Kate. Sorry.
The housing.
Okay, it worked. Sorry.
All right. The housing goal, which is new to this year's business plan, is to sustain the city's diverse housing for all income groups through strategic planning and well-designed neighborhoods, with an emphasis on revitalizing aging neighborhoods. And there are 8 total objectives under this goal, which have been grouped into 2 sort of overarching themes around housing accessibility and availability and housing quality. And so we'll be talking through the objectives from using our subject matter experts from the departments in those 2 groupings. There are 4 measures of success listed in the business plan, and you can see the targets and actuals for FY17, which we just completed. We'll be delving into these measures and a lot of others in the presentation. So, under the theme of housing accessibility and availability, the first objective that we're going to cover is about sort of the broadest one in this area around developing a new city housing policy that addresses all housing types, including very low income, affordable, workforce, and market rate. And I'm going to go ahead and turn it over to Jeff Williams and any other staff who want to jump in to talk through this.
Good morning, everyone. Jeff Williams, City Planning and Development. Wanted to talk a few minutes about the work that took place across a number of different departments, Neighborhood and Housing Services, Office of Performance Management, Office of Economic Development, City Planning and Development, to put in place some general housing principles as we work towards an overall citywide housing policy. We felt it was important to gain perspectives from different departments in terms of what some of the general principles we're working underneath right now as it relates to implementing the housing programs and plans that we have in place. So 6 core principles. One is about anticipating demand, looking at data forecasting to be able to reinforce that whatever housing policy decisions we make respond to the private market, but also making sure that those decisions and those policies don't artificially stimulate housing demand. And as we look at that, look at the tools that we have in place, the market value analysis, community survey work we do, peer city benchmarking to understand what shortfalls we have in housing production, and also to understand the need for the preservation of existing affordable housing units. And the idea of doing this is overall to strengthen the city. The housing policy really needs to support local needs, but also needs to keep in mind that the idea that we get judged among our peer cities, and what are we doing and how are we looking at housing policies that not only satisfy citizens that are here, but also provide the potential to support attracting new residents to Kansas City, Missouri. Building from strength. Again, with a city of this size, it's important to be able to prioritize how we assist housing development, and then also look upon the adjacency and the stabilization of emerging markets. I think you could point to several corridors here, Truce being one of them, where you're seeing development momentum, and you're seeing that the idea is that how does the city support expanding upon that development momentum. Some examples, talking about the KC Cure Plan, and you can see the geographic boundaries, 18th to 51st Street there, Truce to Prospect. Implementing that plan and identifying it as a consolidated plan priority area. The Center City Proactive Tax Increment Financing Plan with funding flowing to that later in the year. 27th, 47th, Harrison to 71. Again, building upon momentum that is happening and then having funds that are strategically placed and used to be able to build off some of that momentum. And then also looking at a mix of housing alternatives. It's understanding the city's housing policy really should look towards creation and retention of housing units at all levels of affordability, also emphasizing co-location of different housing types, and various levels of affordability. A housing trust fund has been talked about to help provide dollars for special needs, lower income, and elderly and senior housing programs, and also leveraging financing for mixed income rental projects using state and federal funds. The big one, and I'm glad it's got its slide of its own and bigger caps, filling the housing rehab gap. We've had this conversations in a number of different forums about the idea that we have a gap when we renovate existing units or even create new ones as it relates to someone's ability to be able to pay a rent or a mortgage to be able to cover that cost. But we need to prepare a financial strategy for city housing development efforts to really eliminate that gap. So I know that the Neighborhood Housing Services and John Wood has worked with private financiers to create an adequate loan program for first-time buyers. Consider lease purchasing of homes for residents. One of the things that the data analysis will prove out is that we are very uniquely positioned here in Kansas City, Missouri, with a large number of single-family residential units that are at a cost and purchase point where somebody could lease to purchase those homes. And then establishing new housing rehabilitation loan fund for single family rehabilitation. At the end, utilizing these principles and working the programs the city has, it's how do you measure progress? Metrics that were clearly identified through the AFFH effort, Affirmatively Further Fair Housing effort, standards coming from HUD, metrics that we are required to capture. I think that will help us certainly understand the benefits of the different programs that we deploy. But also it's critical to support that with performing housing condition surveys and on a cyclical basis. So really having a good understanding from city side in terms of what the condition of housing is in the city. And then evaluate neighborhood quality of life issues. And again, it's the idea, it's not only the provision of housing, but it's the whole host of things that I think everybody would say are universal givens about what they'd like to see in the community in which they're living. So safety and security, accessibility and mobility, promoting public health, and understanding mitigating climate change. All those things that we know that contribute to a good neighborhood, those need to be measured as well as we look to making sure that we provide adequate housing supply.
Okay, so under this goal, we're kind of talking about, as Jeff covered, some of the broad-based issues that have been discussed in a working group around housing policy, and then also have a couple of near-term issues facing us from a housing perspective. The first one being housing preservation. So, Stuart, do you want to weigh in?
Yeah, the preservation of housing has been the staple of our department. Our minor home repair program, we are right at the week of sending a comprehensive performance report to HUD. We have to submit that by the end of the week. This last year we did 303 total. We assisted that many low-income people through a partnership with several CDCs, Northland Neighborhoods, Ivanhoe, West Side. NHS took a break. Beacon, we're doing some with Blue Hills still. So, like I said, there's a partnership here to assist a range of people, and that's something we do day in and day out. The low-income housing tax credit program has been something that's been very a popular program statewide, nationwide. It is being reviewed right now by the governor. We're very concerned about that. Since 2011, we benefited from $395 million worth of affordable housing projects here in Kansas City, over 1,800 units. And like I said, we need that tool. Without those state funds, it puts a big gap in our delivery system. The other thing that we're looking very closely at is downtown affordable housing. About 10 years ago, we did a lot of units downtown with affordable housing. Those are coming off now after about 15 years. They've become a concern because a lot of them go market. And so we're watching that very carefully. And like I said, if we have debt on these properties, then there'll be a conversation about extending the term of that affordable housing. So this slide here shows how many units are created and also expiring. And it is one that, like I said, we're watching very carefully.
So Stuart, when you say expiring, are they expiring pursuant to the original arrangement that the developer only had to provide affordable housing for a specific?
15-year period, yes.
And why was that tied to the abatement?
That was tied to the low-income housing tax credits, yeah.
Okay, so is there a barrier to extending that 15-year period?
Well, there's not. That's what I mentioned. Some projects we have debt on that goes 20 years. And a lot of developers come in and they say that they want us to release that debt, refinance that debt. And like I said, there is an opportunity to ask them to keep units in place and just extend the debt. A lot of them have paid very little towards that second mortgage. They've concentrated on the first mortgage, of course, and then they have to come back in, and there was a lot of capital expenses that they want to make, roof, heating and air conditioning systems, a lot of things that they want to upgrade. So that creates another first loan, first mortgage that they have to take out, and our debt stays in place in many cases, so.
So it seems like if these units are expiring, we're certainly not less in less need of the affordable housing. So what happens to the people there?
Well, in many instances, the rent goes up,
And they
$300 or $400 a month, and they can't afford that because their income is not going up. So they are left to go elsewhere. That's the cruel fact of what happens when affordable units go market. And we see that across the country. It hasn't been as impactful here, but when you have affordable housing overlooking the ocean and it expires and they raise the rents or go condo, it causes severe impact to those residents, yes.
Do we have a policy about new developments and whether or not new developments receiving incentives ought to have a certain number of affordable housing units?
No, we do not. There is a lot of discussion about that. Like I said, it hasn't been put into action yet as far as how many a developer must take.
Why is that? Why do you think?
Well, I think Carrie could speak to that. There's a lot of discussion. Like I said, we're pushing that to get more developers to come forward, and they maintain that it causes them to make the deal unfeasible. So Carrie's here to talk.
Probably depends on how many units you're talking
Right.
about.
Yeah, I think this kind of ties back, sorry, Carrie Tyndall, Office of Economic Development. This ties back into, I think, the comment that was made earlier about the legislative conversations around low-income housing tax credits, which are very important to the financing structure of deals that include affordable housing units. And so one of the challenges then, I think, going forward for developers and working with developers to include affordable housing units in their developments is to making sure that we have a diverse set of tools available to help them make those types of financing structures work. And those low-income housing tax credits are really important to that conversation because obviously they don't generate as much rent back to the developer as a market rate would, and they still have the same costs of construction as they would for the unit regardless, especially when we're talking about doing mixed income type of housing where you're trying to make it sort of seamless and all of the units at the same level of quality.
Yeah, but unless I'm mistaken, nobody does a development using strictly low-income housing tax credits. So as the low-income housing tax credits may stay relatively stable, there is still, and there usually is, a request for more incentives than what they get, correct?
Yeah,
So there could be some offset of the low-income housing tax credit shortfall with incentives of additional thing. For example, an extra year of abatement or a longer period of TIF if that's involved, if we're not giving them the maximum. Lower pilots, whatever the case may be, in order to stimulate the affordable housing market. So it seems like there's enough fruit in the fruit bowl that things could be mixed differently in order to achieve the purpose. Are we trying that?
Yeah, absolutely. I mean, I think that through the advanced KC process that developers go through, we look at the financial gap on projects on an individual basis, and we try to right-size those incentives to the amount necessary for each project and for its unique characteristics. And so, where there may be other policy objectives that we're trying to further that might increase the costs of those projects, we certainly would have the ability to be able to reevaluate the use of abatement. I think my point, though, was that in certain circumstances, there may be costs that could potentially exceed the amount of available resources. And so we just want to maximize the amount of options that we have available on the table.
How do we define affordable versus workforce?
I would probably have to defer that question back to Mr. Bullington.
Affordable housing under the tax credit's below 60% of median income. Workforce is between 60 and about 120%. People that do not qualify for any type of assistance, although, they're not able to purchase housing on the market without some type of assistance. We had a very active second mortgage program for years here. To me, that was a workforce housing. That was right in the sweet spot of a workforce housing program. We did about 1,800 units and incented about $185 million worth of first home sales. We need to return to that type of a program. And that was stopped because of decreased in-home funding from the federal government. We used to get about $5 million. Now we're down to 1.3. So.
Okay.
Does that answer your questions?
Sure, that does.
Thank you.
Thanks, Carrie. Thanks, Stuart.
Stuart, just a sorry, Councilman Kennedy.
He's had his hand up first.
Okay. Thank you. So I was just going to make the observation, Mayor, that especially when we talk about the downtown market, whether it's affordable or workforce, there are some folks that are relied upon to work in some of the various venues downtown, whether it is tourism related or otherwise, that presently have to move, take buses or other modes of transportation. And so to the degree that we're able to stabilize a workforce downtown, whether it's through a program like this or otherwise, I think it's long-term, it's definitely necessary. The other comment I was going to make was I would disagree with Ms. Tyndall just in the aspect that the expense of a project doesn't change whether or not you put in affordable or workforce or market rate housing. The only thing that changes is the return. And so it's really a question of, to your comment of if there is an incentive involved, how does that change the return? And if you take, for example, a 200 unit development and you have 5 or 10 or 20, that's the only thing that kind of messes with the economics. That's the only thing that at least suggests from a return standpoint. And the question is, if the work is done to look at the rates of return, my contention would be that a few units may change that equation a little bit, but to me not detrimentally to cause a development not to happen. So it's just really a matter of, in my mind, is that a policy objective that we want to create more and different types of housing? And I guess I'm really thinking about it because of all the recent choice neighborhood discussion, which apparently is on the front page today, which I have not had a chance to even look at. But it just suggests to me that this is a timely discussion and one where if people are concerned about the congregation of poverty, then it should be our objective to spread that out and therefore create new benefits for everybody involved. And I'll stop right there.
Gotcha. Yeah, I agree. Councilwoman.
Thank you. A couple of comments on what you're referring to, Mayor, when you mentioned, why aren't we doing it, is inclusionary zoning practices. And we've had some early discussions about what that would look like here in Kansas City, but it kind of got lost in the midst of the incentive reform discussion, and there was a reluctance to add any additional policy changes until we figured out what that was going to look like. But I do believe in the context of this conversation, it's worthwhile for us to revisit that when you look at this chart and you see the blue of the units created and the units expiring. We're not anticipating creating enough units. And so, but development is happening in the private sector in a very robust way in the River Market, downtown, the riverfront, the Northland. And so I think short of us putting forth some type of policy to make it happen, it's not going to. And the conversation is happening right now in the Northland about relocating those choice neighborhood families. You end up with the NIMBY issues where people don't want affordable housing or what they perceive to be affordable housing. But from what Mr. Bullington has, made comment about, these are people who are working people in the service industry, school teachers, people who are public professionals early in their career, that the market for them is probably going to be, $800 or less. And I don't know what the change in rents are going to be from what they're paying now downtown. But if you look in Kansas City, you can go to Zillow or any of those kind of sites like that. And if their rents are, $600 or so, where else in Kansas City they're going to go and find a decent apartment for $600? I mean, they're going to end up in one of the suburbs likely if they want a comparable quality of neighborhood. So that's something that we have to be mindful about in Kansas City, how we approach that. So as we move forward in this discussion. Secondly, I benefited from that second mortgage program that we had. I bought my first house in '98. We had a really good program. It was a 70-30 program. I was able to buy my first house at 18. I had been working full-time, and they had non-conforming loans that they issued for people that were working, and so it was a very good program. But short of HUD funding, is there a way for us to bring something like that back with using some other funding sources?
I think there is. So John Wood of Neighborhood and Housing Services. I'll just throw it out there. We've talked about it before, like the 1/8 cent sales tax is an option. I mean, is a possibility because there is some flexibility in that fund over what's a 10-year period that you can do a lot of good. I believe the funding that we allocated, at least the years I've been back in City Hall, has been about $400,000 per year in home dollars. So if you took, say, $1 million of that, or $500,000 or some number between $500,000 to $1 million, and dedicated that for that purpose, I think you could do a lot of good. Plus, you wouldn't necessarily raise the issues of that come with the federal dollars, of the lead base and those other things. All of they are important issues, but a lot of the federal regulations that come with using federal dollars wouldn't be an additional burden necessarily.
So what is that amount that we would need? So if we were to reintroduce something like that second mortgage program, how much money would we need to fund that program?
I mean, to get back to the pace that we need to be at, I think we need to do about 200 a year, maximum 20,000 each. That's $4 million.
So $4 million per year?
Yes. Would create a program that had the kind of energy and the kind of, so that the realtors, the banks, all of the various people could get involved and see that as something that they can depend upon and encourage people to take advantage of. I mean, we used to have busloads of people from the Northland coming to 63rd and Paseo to close loans on Saturday. That's the kind of thing we need again.
So,
We probably ought to keep moving, or we're going to wind up running out of time like we usually do, which is not optimal. So, let's move on to-
You spoke to this already, but do you want to expand on it
Yeah,
a
I'll
little
just,
bit?
there is an active discussion right now in the governor's office and his committee about all tax credits. Like I said, Kansas City, St. Louis, the entire state takes advantage of those programs. So we're watching that very carefully.
I wouldn't say the entire state. That's exactly why they decided to have all the meetings discussing tax credits in little towns and areas that didn't do much with it, so that they could avoid the main users of the credits, Kansas City, St. Louis, Springfield.
I was being kind, but yes, you're right. There were people in Branson and other places that said affordable housing has been, a benefit to them.
Yeah.
So,
I think you can just about pretty much count on some significant cuts coming to all of the tax credits. So we need to be planning how we're going to address that and not, I don't know how we're going to address it, but that's why you guys are doing what you do.
Well, that includes also the historic tax credits too.
Except for revamping, or except for renovation of the Capitol.
Okay.
It's funny how that works. All right.
This is the number that to get to your point, Mayor, $112 million is what we received from the state over that period of time from 2011 to 17. That's about $18 million a year is what we would have to find, in other words, keep the program going. So,
And there's no indication that HUD's going to be helping to make up any of these shortfalls or?
no.
Yeah, it's okay. All right. So basically, we're kind of on our own again, or will be. What's new? All right, next up.
I think so. Circling back, this closes out the section, and then we go into a little more detail about the action plan and our 5-year consolidated plan. But Jeff Williams walked through some of the general goals and strategies that have been discussed, and kind of linking these together. There's a sense of where I think we're headed with a broad-based housing policy that would look at the whole city and in particular, aligning a lot of these with other planning efforts, especially a new comprehensive plan and thinking about the issue of housing kind of holistically. So I don't know if anybody else wants to weigh in before we go into the next section.
No, well, again, I think it's alignment with those reports that we're mandated to do, be it our consolidated plan, and then with the thing that we know we need to do is updating our overall comprehensive plan. But again, as this policy conversation happened, clearly we have need and we have programs to operate. So we want to have a bit of a framework for how we move forward in doing that.
Jeff, in updating the comprehensive plan, are we updating it in such a way that we're achieving some higher levels of sustainability?
Well, yeah, and that planning effort was probably about maybe a year or so out. But yes, I think it's a whole host of issues that come underneath the umbrella of a comprehensive plan. Some of it's about sustainability, some of it's about housing. Clearly, it's about transportation. Again, we've had great involvement working with health department in terms of public health. So I see the comprehensive plan being the framework from either emerging technologies or just some basic quality of life issues that the city really needs to have a plan for undertaking in really a comprehensive manner. And again, I'd say for housing policy, really a lot of the emphasis here, this is an overall city policy for people of all levels of income. So it's really going to need to be strategies to look at folks that don't have income at all to the folks that are just needing a little bit of assistance to be able to be successful in the housing market here.
Okay.
That moves us into the next objective, which is to implement a new 5-year consolidated plan and fair housing initiative.
Now, this is just a quick glance of our entire year. We're, of course, in July. That report goes to HUD by Friday of this week. We take a little bit of a break, and then we start right back up in August, accepting applications for next year's funds, which right now in the administration's budget are zeroed out. So again, we need to work at that level to get those funds secured. So,
Wasn't one of the main goals of the affirmative fair housing plan that we entered into and that we, I think, excelled at with HUD and the government, that we would not concentrate housing, that we would look to expand our affordable housing into more suburban-like areas and
right, I think this next slide, Kate, speaks to that.
Okay.
We are a city of plans. We have 18 area plans that cover the entire city. We are focusing on 4 of those with our funds. The balance or the that I've stressed is that we can't take all of our money and move it into areas of opportunity. We have to continue the course to fix houses, build houses, do the kinds of things that we've been doing. At the same time, we have about 39 goals in our affirmative fair housing plan, and we're working with not only within the city, but 4 other entities throughout the metro. That was a key to this plan. HUD was very interested in us being one of the first to come in with a regional plan. And we will be meeting twice a year, and we're putting together a business plan for kind of how to implement those 39 goals. And one of the keys to that plan is the choice program. So it's important that we provide guidance and make that project happen.
Okay. That's the article that you haven't got around to yet.
Yep.
It's a fun read.
Yes, I'm sure it is.
The second slide is further concentration in some of our targeted areas. The Kansas City Cure area, Blue Hills, down to Marlboro, all the way around the Bannister area, Mount Cleveland. We're looking at the old Chick School site as a project, and then continued efforts along the 39th Street corridor. Again, here's a quick glance of our funding recommendations that we're implementing right now. We've got all of our public service contracts, emergency solutions contracts out. We've got a contract before council right now for the public facilities. We're tempering those contracts because we still don't have a grant agreement from HUD, and we're not interested in getting into some large contracts, $400,000 or $500,000 until that grant agreement comes in.
We're not there yet in this, but just total aside, with regards to the, to our federal court, what am I looking for?
Receivership?
Yeah, with the agreements that we made to get out of receivership, are we on track?
Yes, that's part of this report as well.
Yeah.
We're down to just Beacon Hill now.
Okay,
We've got some very large-scale projects set to close, the 27th and Troost project. There's a hotel that's getting closer and closer. That's been a long one. John wants that to move faster than anyone. There's been a lot of housing construction. Every time a house gets built and we get a certificate of occupancy, that liability goes down. So, like I said, the pledge to the manager and the council 5 years ago was that we'd get that to 0, and we're on course.
where are we now?
There's about $4 million, I think, left.
Okay.
And the colonnades has been a struggle. That's set to close on the 18th of August. So that will take off $3 million.
Are you sure?
Yeah, this time,
Sorry, I just had this.
The champagne is still on ice.
Okay.
yeah, okay.
We have another call today at 1 o'clock to make sure that we're on track. But it has been a challenge.
What about the Little Sisters of the Poor? Is that part of this as well?
It is not. Those properties are part of the Homesteading Authority. We still need to build 4 houses there to build that out. And we're not going to forget it. It's part of our Rebuild KC strategy to make sure that those things get done.
So, since the mayor's not in, I might ask another question, Stuart. And on the funding recommendations, and I know you mentioned that that contract with HUD still is yet to be done. I guess my question is, where do we expect the numbers to be, or is that even unknown at this point? What the final number will be?
These are the final numbers.
Okay, so they've okay.
They passed a continuing resolution,
Okay.
and we were not able to send our 5-year plan in until we got actual numbers, and we got those at the first week in July.
Okay, very, I know it's always a lagging deal,
Right.
so, okay.
So that plan has been submitted.
But we're confident in this number.
Right.
Great, thank you.
And this is a chart of our outputs, how many units of different categories that we look at doing every year. Again, about 350 minor home repairs, public facilities, Emmanuel Child Care Center is one of them this year that we're going to be helping to make happen. And Deborah's very excited about that, Deborah Mann. So she calls us about every other week. So, but these are the kinds of things that we do with a range of programs. We do run quite a comprehensive program from, like I said, minor home repair, public services, economic development. So it's, and this past year we even expended about $3 million of Section 108 funds. So that was to get the Oak Point project completed, which has been another long-term project. This is just the, like I said, the multifamily and single-family housing. I might add that single-family housing is hard to do. We need to think hard about how we're going to rehab, do whole house rehab, and also build new housing. That is something that we need to put together, and like I said, we need to be up into the 50, 100 range to keep pace with vacant lots and other things. But that economic or that house building program is not in place.
And I think the other part of that is we have to have the banks at the table. We can't bear the burden alone. And so I think it's key that we, whether it's whole house or some moderate rehab program, that we attempt to create a model that the banks can feel comfortable with and that we're comfortable with them being involved in it. But that's the only way this is gonna work.
And is that the main holdup, is the lack of bank involvement?
Well, I think to some extent there is the bank holdup, but I think we need to prompt them as we're doing with the rehab program. We'll talk about in a little bit, but I think we need to give them some models and then kind of force the issue of the conversation and bring them to the table. There are some banks who in my conversations are interested, but they're comfortable with the 80% loan to value model and all the regulations that come with that. I think we need to get them out of their comfort zone a little bit, and maybe that's where our dollars, the public dollars, would kind of fill that gap and get them a little closer to maybe 70% or something of that nature.
The challenge, Monarch Manor, the old ballpark site, has had 47 units of housing subdivision since the 2000. We're just now seeing that project is coming to market. There's 2 foundations there now. Both of them are market rate houses. The problem when you drop down below 80% is that the houses are still going to cost about $190,000, but they can only afford about a $130,000 house, so there's a gap. And that has to be non-economic or HUD funds to fill that gap. And over in Kansas City, Kansas, their number was 64 houses before they got to market. They had to fill a gap on 64 houses before that happened. So when we move into Key Coalition, when we move into some of the other neighborhoods over into Mount Cleveland, we'll have to bear that gap for several years before the market catches up.
Okay. All right, but you say you're working on some modeling?
Yes, on the rehab side, we'll talk a little bit about that.
Okay.
At the last KC stat on housing, we talked about minor home repair as being a really obviously large component of our consolidated plan, and there were some questions, and so as a follow-up, the next few slides kind of provide an overview of a couple years worth to kind of give a sense of the program. So Stuart, I don't know if you want to talk through.
Yeah, we, like I said, the minor home repair program is one of our main programs that we operate. We take about 200 applications, 300 applications, and then work those applications throughout the year. We have partners with community development corporations, the Northland, like I said, West Side, and also Ivanhoe. We raised the income guidelines to 80% this year to expand, turning someone down who has a couple dollars over 50% of median, and we do a lot of roofs. I think there's a slide that Kate has that shows the type of things that we do. Roofs, of course, are most expensive, and it allows people to stay in their homes another 15 or 20 years. So that is key. And they are allowed one item in non-targeted areas, 2 items in targeted areas like Marlboro and Key Coalition and others, so they can do more work.
Okay.
This slide here just shows you impaction as to where our dollars are working. Like I said, they are citywide. We're seeing a lot of people, especially up in the Northwest, Platte County, where they're aging in place, and they need a new roof. We've done that. So.
Okay. Thanks.
Okay, that brings us to the next objective around single-family rehab program, which we've touched on now a couple times, but it's actually its own objective. So let John speak to that.
Yeah, this is, I actually had reported on this before, but since December, we've been meeting with 6 banks who have expressed an interest in a rehab loan program. As Stuart indicated, at one point, we had a rehab loan corporation that was very active, financing 200-plus houses a year. We would love to get back to that level again, at least work our way back to that. Currently, so what we're faced with, though, as has been noted before, is that properties are going to appraise at, in this particular example, at $30,000, and that's pretty much what we're finding to be the average in a lot of these older neighborhoods, like in Key Coalition and Ivanhoe and places of that nature. But the cost of construction is going to be what it is. In this particular example, all in is about $43,000. The problem is that a bank, if they are actually making a loan to this, in this particular example, is only going to fund 80% loan to value, which is the $30,000, $24,000. So if you're all in at $43,000, you have actually a total gap of $19,000 that you have to fill in one way or the other. So that person that wants that home either going to have an additional $19,000 to fill the gap, or, it's us in some way, and that's the model that we're working on. Currently working with, again, the 6 banks, working with LISC. We're actually working with one of the law firms that's providing some pro bono work and helping us create a model. And so we've had a couple of meetings with these banks. We're in the process of having a 3rd meeting coming up in about a week or so with this model. And the goal is to get the banks, move them from this 80% loan to value up to 95% if we can get. And so that's the conversation that we're going to have with them. But it's going to take probably some persuading. But again, they're at the table already, so that's kind of where we are. A program has to be targeted. We think that if we took, for example, a Key Coalition or maybe a piece of Blue Hills or someplace like that, and maybe 8 to 10, 12 square blocks, and then target those not only with rehab, but also we're going to have to augment that with some infill new construction and other things, systematic code enforcement. We feel that would be sort of the model that we would go after, and to not only get people energized, but also get the banks at the table. Because quite frankly, what we're finding, banks don't want to be the only one in the neighborhood making a loan. They want their investment protected with other activity. In Beacon Hill, for example, what we're seeing now is with the new construction that's going on, with the larger homes that are being built. We're also seeing rehab. You drive down Tracy between 27th to 26th Street, you see at least 2 or 3 rehabs going on all the time. So people, and they're doing it on their own. So I think that's the kind of energy that we're trying to get started.
Okay, great, thanks.
Mayor?
Yeah,
if
go
I
ahead.
may. John, I might suggest that pending however your meeting comes, I might offer as an alternative the EDC Loan Corporation. We have been talking in there. In fact, I've got a board meeting in about an hour about some alternative financing options that they might be able to employ. And they have presently about, I think, $300,000 in funding that they can use for a variety of different things that have come from various funds that they now have. And although primarily they work with businesses with SBA 504s, they want to expand their portfolio. And I just suggested as if you continue to have some issues with the traditional banking community, there may be an option there that you'd want to employ. And I'm happy to open that up if you need to.
Sure.
Sounds good. Okay.
And so our goal primarily is, Mr. Mayor, is have you announce this before the end of December 31st, 2017, this new program. So that's what we're moving toward. Again, we hear the banks that are listed that we've been talking with, and we're at the point now developing the structure and hopefully get to a final commitment from the banks. And then the other piece of this is finding an organization that would actually be providing the loans. So the lender would not necessarily be a bank, would be a nonprofit, a financial intermediary, a CDFI type organization, because they can make loans that banks probably wouldn't make because of the regulations that banks are under. So we would also, and we've got some interest from several organizations that have expressed an interest in being that organization, is RFP that out, get the organization, find the organization, and then being able to make that declaration that we've done this.
The areas that you talked about, and specifically where you're trying to cobble together a large square block area, is that in the Casey Cure Zone?
Yeah,
Good,
yeah,
good.
they're at the table on it.
Good, fantastic, thanks.
In the final objective in this, under this umbrella set of objectives about housing accessibility, is to integrate the results of the market value analysis into city housing and economic development strategies. So I can talk through these slides, but if anybody else who wants to jump in and comment, please do, because this has been a very much a group effort to both oversee the development of the MVA, which was released in January, but really this integration part into city operations is neighborhoods has been a key driver all along, and then city planning development is actually the entity that's kind of overseeing the results and pushing them out to the community. So this is more than anything just sort of a reminder slide of what the results of this analysis look like. And there's a much more dynamic map online on City Planning's webpage that anybody can go to. They can also download the results. So being very transparent, trying to make the results very accessible. But it essentially gives us 4 groupings of housing market conditions. And so this is about the housing markets, not about the people, or this isn't a person-based thing. This is about the markets in these specific areas. But so it allows us to kind of see the granularity of how housing markets differ across the city and where different areas are grouped, but even kind of some of the transition points, I think, provide us with a lot of insight into, that idea that we've talked to, building from strength. So where can we find areas of more distressed markets that are proximate to stronger markets and leverage some of that strength and pull in private investment that way. And these are all of the metrics, or not residents, but the other metrics are the ones that were incorporated into the market value analysis to come to these results. So sales, owner occupancy, permit activity, violations, vacant homes, distressed sales. So these were all important components. So in terms of how to use or apply that. Basically, what we've got in this set of slides is several kind of little case studies. This isn't a comprehensive list, but the ones that were top of mind over the last few months. Certainly, all along, looking at the MVA in tandem with the land bank, many other cities that have done MVAs have a land bank in place and have really actively incorporated. And I think really Ted Anderson, I think, was working with the results of the MVA as soon as anybody. He said that, you know, when they put together their Heart of the City sale in February, he used the MVA, he and his staff used the MVA to help select the properties to incorporate there. So at a global scale, it tells us that not surprisingly, 94% of our land bank properties are in the most distressed markets. But again, not all of these are created equal. And so, first of all, I mean, 6% are not. So that gives some insight into potentially higher value areas where we could get a higher return for those properties. But even within the distressed markets, the difference between a G and an I can be substantial. Also, the difference between a G that's proximate to an E or F as opposed to an I that's really surrounded by other I markets. So all of this, I think, is information they can use as they actively kind of market and identify the highest and best use for those properties.
You guys got anything on that? Nope, okay.
She's doing a great job.
We did an overlay of, turning back to the topic of minor home repair, we did an overlay of minor home repair over the last couple years by MVA category. And so there's an inset of what the map looks like at a point level. But you can also see how it breaks down into categories. And so, you know, I think this gives some insight into what we've done to date, but and may provide some idea of how we could use the MVA to target minor home repair and similar programs going forward. As you can see, the vast majority of the minor home repair efforts have gone into G and H markets, which, again, going back to Stuart's discussion of the priority areas, many of those are G and H and I markets. So that kind of shows that targeting. But a decent number going into the E and F, which are those middle markets that we especially have seen kind of grouped this south, our first string suburbs, basically, kind of southern part of the city and then just north of the river. So.
Okay, I think the interesting note that there were some use of these funds in A areas as well. So it's just understanding the dynamic of, even though you might see an area that appears to be a higher income area or homes of higher value, there's still areas of needs all across the city. So that's why it's interesting when you map this type of data on top of MVA, you begin to get the full dynamics of a particular community.
And that goes back to, a point that Stuart's made about, minor home repair is an income-based program. So it's not based on the surrounding housing market. It's based on the income of the occupant. And I think even before looking at this particular chart, Stuart had an example of, elderly homeowner living or aging in place in a higher income neighborhood or higher value, kind of the homes of being higher value, but really herself was constrained by her own resources, and in order to stay there, needed the roof repair through the minor home repair to stay. So, life expectancy, which Jeff referenced, the connection with public health. I think this is just kind of a just the tip of the iceberg type look at this. There's a lot more detail that you can go into in terms of all the determinants of health and how they align with the market value analysis. But these are the lowest life expectancy zip codes, and just kind of blocked out, you can see what the MVA, how the MVA lays into those. And again, not surprisingly, you see a lot of the more distressed markets, but you also see a little bit of variety there. So I think especially as you drill into the determinants of health, maybe that provides good insight about how you can pull from strength and improve the public health or the conditions in these areas. Just a few other examples. City planning, being kind of the owner or maintainer of the data, is using this within their area planning process, at least the area plans you're working on now. I know you've also been working on some kind of case studies, kind of neighborhood views of market value analysis in different areas.
Yeah, no, in addition to making sure that we can institute the MVA process across all of our area plans. And so while we'll be done with updating all the plans by the end of this year, we're going to start a new 10-year cycle again. So I want to make sure the MVA is always a part of the foundation of an area plan. And then this data does help us as we look at things like the Center City Proactive TIF. How does MVA work within those types of boundaries? How can you begin to take, which is a relatively small area given Kansas City's size, and even be more specific about the use of resources?
I think, yeah, an important point along those lines is a lot of times we're very familiar with the concept of targeting. But I think a lot of times when we talk about targeting a neighborhood, and a neighborhood in and of itself can be relatively large. And so I think where the MVA, and you could still identify a neighborhood based on things like neighborhood participation and leadership and other factors, but then you could use the MVA to say within this neighborhood, how do the market conditions vary, and are there areas of relative strength and areas of relative weakness, and how might that change our approach in terms of where to invest or what types of tools to use to invest. We've talked a lot about the use of the MVA within code enforcement, and I think there's a lot of openness there and some efforts underway to think about that. And then externally, so important to remember, the MVA was done with a view toward it being a cross-sector tool that is available to everyone, but gives everyone sort of a common viewpoint into market conditions. And of the ones we know about, which is not comprehensive, UMKC Center for Neighborhoods has their training for neighborhood leaders, and they've incorporated this into that curriculum. The neighborhood leaders were really enthusiastic about it and in applying it. AltCap, who was one of the funders of the MVA, is interested in integrating it into their lending products from a targeting standpoint. And then we're really still in the process of reaching out to all these different stakeholder groups, neighborhoods, industry groups, to figure out how they could apply it and just introduce them to the concept, really.
I think it's also important to keep in mind that the funders for the MVA were varied. We had at least 6 or 7 different funders, including Hall Family and H&R Block Foundation, and I actually just did a report for H&R Block the other day about this. And so I think it's important that we keep that in front of them as they are looking at strategically investing their dollars in neighborhood revitalization as one of their areas of interest, that we stay in front of them and to partner with them as much as we can, so that it's another way of leveraging limited dollars we have with private dollars to have other private dollars come into an area.
Yeah, and to that point, I think we're actually in the process of setting up a meeting with both funders to give that presentation and kind of elicit their thoughts. Any other questions, comments about market value analysis?
Just if people do have questions about it, clearly check out our website. The dynamic mapping tool is great, but if people have questions, Brian Jackson, who's in City Planning and Development, so brian.jackson@kcmo.org, reach out to him and he can answer questions and maybe help you with some data customization.
Okay, the next 4 objectives fall under the umbrella of housing quality. And the first one is to perform targeted housing condition surveys. Stuart, I don't know if you want to speak to this or I can, but.
Yes, we did a comprehensive 82,000 parcel condition survey back in the year 2000. It is good to take a look at your condition of housing, I think, every 10 years. Like I said, what we're looking at now is a targeted type of housing condition survey in the areas that we're really focusing on. Like I said, we're still looking at trying to put the money together to get UMKC out and do that. We've had some new tools since the last time we did it. Like I said, we're looking at using those in this new survey.
Yeah, and I think that this is one that we have an idea of how to do it and even a proposal. So some of the resources that have been mentioned could potentially be used. This would just help direct investment. Next objective is develop and implement strategies that increase the proportion of children living in lead-free homes. And so for this, I'll turn it over to the health department.
Amy Roberts, Kansas City, Missouri Health Department. I know we used a slide back in January, so it's kind of a review looking at the significant number of homes that were built before 1978 here in the city, and 1978 was when land was banned from residential housing. So the orange section shows a little over 70,000 units that were built before 1940, and those have the highest percentage of lead within the paint. So at different points in history, different amounts of lead was used in paint. The yellow section, it has around 86,000 units built between 1978 but after 1940, and those are still at significant risk, but again, the houses built before 1940 are the highest risk. And both of those add up to a large number of units that are at risk for having lead paint, and then also for deterioration. And deterioration is what causes the paint to crack and turn into dust, and that's how kids get their exposure. Again, lead poisoning, the primary cause is deteriorating lead paint in the homes, primary residence of kids 6 and under. So a little review about the effects of lead poisoning. Again, it is a global toxin, so it affects all body systems, and those effects persist throughout the life of the person. Children absorb a higher percentage of lead than adults do, although adults can be lead poisoned as well, and adults are usually exposed at their job. So kids get their exposure primarily at home. And kids can be exposed through products like toys and spices and imported candies, jewelry, things like that, but their primary risk is from, again, deteriorating lead paint. You can die from lead poisoning. We see that occasionally in this country. It is more prevalent in other countries. But, you know, since we've known of the dangers of lead for so long, to have a child die of lead poisoning here is pretty significant. But we see the greater effects are at these lower levels. You actually see a higher rate of negative effects at the lower levels. So you can see negative effects as low as a level of 2 micrograms per deciliter, which is how we measure lead in the blood. And there are studies that show decreased math and reading scores with levels as low as 2. Now, we know that the level that we're using right now for intervention is 5 micrograms per deciliter and higher. So again, when we're looking at the children who are affected by lead poisoning here in Kansas City, we're looking at those with a level of 5, and we still see negative symptoms with levels as low as 2. When we look at the effects of lead on the community, all blood lead levels are reportable, even 0. So that helps us to get a broad picture of what's going on in the community. Some people are just looking at what we call positive, but we do examine all of the levels, not just levels that are 2 and higher or 5 and higher. So this graph shows it shows how many children we're seeing with elevated levels by month. So these are just kids with elevated levels. So that kind of shows how our lead poisoning kids are coming in and what the breakdown is. And you can see June, we see a lot of kids. August, we see a lot of kids. And we have a bump in November. And so that makes sense because in June, we're seeing a lot of kids who are getting their well child checks. In August, it's back to school. And in November, those are the results that are coming in from the bulk of the back-to-school testing that's done. So August is just that, families that are getting their kids in early and doing that testing, and then October, November, we see that following up the kids who are getting tested. And again, the red is the children with the most significant blood lead levels. Medium is that orangish color, and the yellow is still kids who are lead poisoned and still significantly affected, but that's that top number. Thanks. Looking at, again, where we're seeing them, I know you all are are familiar with the high-risk areas here. So the darker area is where we're seeing the highest percentage of lead-poisoned kids, and then it moves outward, and it is consistent with the age of housing downtown here. And in these areas, these highest risk, the darkest areas, more than 53% of lead-poisoned kids are in those areas. So targeting that testing and targeting those interventions is really going to make a difference in the burden of lead poisoning that we see here in Kansas City. Again, so now this is a graph looking at by month of the number of kids tested, because we've talked about testing before, and testing is a significant issue for lead poisoning. Testing rates tend to be low throughout the state, and around a little over 30% of the kids who need to be tested are tested, and that is consistent here in Kansas City as well. And this shows one of the things we look for is for our staffing needs and how to organize our interventions. We look at how those kids are coming back, and again, you can see it's consistent. We're seeing a lot of kids tested in May, a lot of kids tested in October, and then August. Those are our biggest months. So we have our staff that does a lot of testing in the fall. They do back-to-school testing. They tested all the Head Starts. And then our case management folks are seeing the elevated kids as these tests come back.
And Amy, can you clarify, you just sort of spoke to this, but so that we have access to these numbers through state reporting, is that correct? That's how we know how many people were tested globally throughout the city, or how many kids, rather?
Yes. So the state, because lead poisoning is reportable, just like a communicable disease like measles or mumps, the state takes all of those reports from all of the labs and all of the providers, and then they provide them to the jurisdiction for that health department. In addition, we receive the results earlier for all of the tests that we perform, that our staff performs. So again, this is the breakdown for the entire city, not just what our staff performs. We do around 1,300 to 1,700 tests within our program per year.
I'm sorry, say again now? You do how many a year?
It's between 1,300 and 1,700 per year, the health department, our nurses.
Who's doing all the rest?
The other providers in the city, so pediatricians, Children's Mercy is one of the number one facilities, all the pediatric groups, other Jackson County, anybody who does blood lead testing.
Okay.
So we're a provider, but then we get the information from everyone. So looking at lead poisoning and testing of children by zip code, this map shows here, you can see the kids that are tested. You can see that dark pink area on the right. The highest number of children tested is our high-risk areas, so we're seeing some success there. And then those elevated blood lead levels are right in that same area. So what we're doing, we're looking in the right place. We're testing in the right place. We need to increase our testing and increase our interventions in our highest risk areas. And this one on the left, of course, is a projection. So that does not include the number of children that have lead poisoning that we know about. So if we wanted to see the entire burden of lead poisoning on Kansas City, we would add 350 kids to that 806. So 806 is the number of children that we know are there based on the age of their housing and the rate of lead poisoning and the number of children. So that's how we get the projection, and then in addition, we add our known lead poison kids on top of that number. So it's around 1,300 to 1,500 kids a year.
So how do we stack up against peers? Or is there any such comparative analysis?
There is, in terms of lead poisoned children, you mean?
Yes.
Well, we're the city with the second most number of lead-poisoned children in the state. St. Louis is number one. There are cities in our area that have a significant issue with lead poisoning. Iowa, we have more high-risk housing than Iowa. We have more ABL kids than Iowa. If we're looking at like Des Moines, Kansas, Wyandotte County has a significant number of EBL kids. We have more kids. We have more, like a greater number of units of pre-1978 housing. So for our city, our size, we're comparable. We don't compare to a city like Baltimore. They have more housing and then a higher rate of lead poisoning as well.
Okay, thanks.
And Amy, can you speak to what's the interaction generally with the schools or the school systems in terms of, because they may obviously be the ones not diagnosing but witnessing the effects of lead. So is there a relationship between them and the health department, or them and other providers in terms of bringing it full circle?
That's a great question. And, you know, we target, we work very closely with the Head Start system and test children for them. We work with a number of daycare providers. But once we get to the school system, you know, our highest risk age is 6 and under, and actually 2-year-olds are the highest risk. So we really want to get those kids before they enter school. Although we do work with the schools and provide education, but what we get from the schools is that's when the children need IEPs and special ed. So that's the schools, when they get into first grade and kindergarten, they're seeing kids with a speech delay, children who can't sit still, children who are acting out, you know, more of those things. So they see more of the effects. And it's a little bit late to get those kids, because sometimes if you were to test those kids, if you test a 3rd grader, they are most likely not going to have lead identifiable in their blood, but they've already suffered the effects. So looking at the number of homes that we have remediated, again, we have 157,000 homes, a little bit over. Our Lead Safe KC program is our home remediation program. That's, we can do help a few families without using that program, but it's usually 1 or 2 per year. So the Lead Safe KC program is the one that really, we're really able to help our families. And we've had about a little over $19 million since 1997 in HUD lead hazard control funding. Been able to remediate 2,500 homes, but still that's less than 2% of the total that need it. We're pleased to be awarded a new HUD grant a couple weeks ago. Out of 28, there were 28 awards out of 100 applicants, and we were able to secure $2.9 million, a little bit over. This will also include Healthy Homes funding, and that's the funding that we're able to provide in addition to lead remediation for hazards. We can look at other hazards in the home and help those families out while we're in the home. So that is for things like slips and falls, security issues, asthma triggers, plumbing issues, mold, things like that. And that's based on our inspection results, Healthy Home inspection results.
Congratulations on the good score.
Oh, thank you so much. We were very pleased. You know, I have to shout out to my team because we do it in-house, and I'm really happy to have a very dedicated, talented grant writing team.
Good, good job.
And Mayor, just to add to that, part of that score really is the fact that when HUD comes in annually to evaluate, they're getting 100 scores on their evaluation because they move the program forward and are efficient in doing it. And we have a lot of minority contractors that live in the areas that we're working, so that it's helping with that also. And I just want to commend the staff on that.
Okay, great, thank you.
Thank
Good
you.
job.
So back to looking at how we are trying to increase awareness and let families know about our services as well as the lead issue. Low-income families are highest risk for lead poisoning, but it is not exclusive. So we do target everyone in Kansas City and in the metro area. We did create 4 infographics, which are basically kind of advertising pictures that were put on YouTube. We also have them on our public information kiosks at the health department, and we've used them on Twitter and some other outreach events. We have a video campaign, so we have 2 videos. One is sort of a teaser video that presents lead as being kind of a, it's done as kind of a horror movie theme, and it's kind of shows lead as a horror movie problem. And the other one looks at the Lead Safe KC program and kind of shows this is the solution to the horror picture of lead poisoning. And then we frequently do water bill inserts in the water bill. And we really have a lot of success. That's one of our most successful interventions or outreach campaigns.
Okay, thank you.
Okay, the next objective is around implementing a healthy homes inspection program through the health department to prevent rental property occupants from environmental hazards and improve energy efficiency. And I believe Nasser is going to speak to this.
Good morning, Nasser Jahari, Health Department. Amy did a great job in talking about lead and the effect of lead on children in Kansas City. I want to try to deviate our focus from lead to other health concerns that we usually notice during some of our healthy homes inspections that we do prior to start working on a property. Before I start, I want to bring to your attention that in Kansas City we have almost half of our residents population live in rental properties. 34% of housing in Kansas City are rental properties. That's 65,000 plus or minus housing. Actually, I would lean towards more properties because this is, last time I looked at the U.S. Census, it proposed a little bit more than that. As I mentioned, half of our population, almost 200,000 people, live in rental properties. 1 of 4 families in Kansas City, they have a child of asthma here in Kansas City. Every year, 1 of 5 children in Kansas City they has to go to ER, and the average cost for the ER visit around $5,000. Some of the few things that we usually notice during a healthy home inspection is radon. I want to talk about a couple things before we move into the list of items and concerns that we see during an inspection. Radon in metro rental homes are likely to be tested for radon during our inspections. 14%. From 2012 to 2015, we completed 197 healthy homes inspections. 14% of those came back with radon. As from the EPA numbers, as you see on the slide, radon is considered the second lead for cancer after smoking. 21,000 lungs cancer-related deaths in the U.S. Annually. The other thing that I would like to talk about before getting to our healthy homes ordinance proposal is that renters are twice as likely to live in homes with neglected maintenance. The number one concern that we see during our healthy homes inspections is the slips and falls, concerns related to slip and falls in the city. Metro renters were also twice as likely to go without heat for more than 1 day in the winter. We're trying at the health department to actually get some kind of a control over what we have when we go out and do inspections. We have 3 active programs that may help to a certain extent in fixing part of the problem. We have Healthy Homes program. We have the Lead Safe KC program, as Amy talked about. We were lucky to be the recipient of the grant since 1997. And we have an integrated pest management program, which include the rat control program. Some of the strengths that we have at the health department pertains to this subject. We've been the lucky recipients for this grant since 1997. This year we received it. We were very anxious about it. This is a 3 years grant. It's never guaranteed. The other strength that we have, the trained staff. We have the staff that's been doing this since 1997, since we started receiving those grants. Some of the weaknesses, we do not have any enforcement for compliance. And again, as I mentioned, unsecured funding. During some of these risk assessments, inspections, the chart will show the list of concerns, the list of if you were to call it citations that we see during our healthy homes inspections. For a 3 years period, we did 197 healthy homes inspections, and this is a list of all these concerns that we see at these properties throughout the city. Some of these concerns, and maybe in a future presentation, I would love to show some pictures. Some of these concerns are pretty extents where we had to take an action immediately on the spot.
Nasser, I just wanted to break in and ask a clarifying question that I think I didn't get the first time I looked at this. But so obviously the scope of your inspection was only within this HUD grant, only within these properties, so 197 units. So these hazards you found are within the scope of those inspections, which means that really, so 125 doesn't sound large as a raw number, but that means close to 2/3 of the houses that you were in for lead also had damp and mold.
That is
damp and
correct.
mold
That is
issues.
correct. 197 units. This is the result only from 197 units that we were able to complete a risk assessment so we can move forward with our funding or with our lead grant.
And so just, again, extending out from what you said about the number of properties that we know are in need of potential lead abatement and also of this age, I mean, when you extend out these potential risks, the extent to which they're probably present is by a massive order of magnitude.
Yes.
So.
Some of the key challenges we have, budget. We're limited on budget, as you may know, to start enforcing and to start making just a little bit of compliance. It requires additional funding. Lack of enforcement. We do not have an active ordinance that will give us the authority or will give us the enforcement power to get landlords or property owners in compliance. And the last one, as you may know or expect, opposition from the industry, stakeholders, from landlord, property owners, rental associations, and so on. We started doing our research throughout the country. We don't want to be the first in initiating something new. We researched out of 57 cities that have the population over 300,000, 35 cities throughout the country have an existing program, something in place that will allow local jurisdiction to inspect rental properties and to regulate rental properties. Out of the 35, actually 2 jurisdictions or 2 major cities are in the process that they may have their ordinance in place within the next 6 months. Also, we looked at the local jurisdictions in the metro area. I'll comfortably say almost every local jurisdiction in the metro area, they have an active program. The City of Independence just started working on theirs. The City of Overland Park also just started working on an active rental or property inspection program. When we looked at all these jurisdictions, we tried to share, we tried to collect as much information as we can, and we looked at what they look for during their inspections. Some cities throughout the country, some cities, they have a 17 plus pages of a detailed inspection form to start inspecting, from health concerns in the property all the way to the actual, to include some codes violations. What we're trying to do at the health department, we shrunk all of that to look at only health concerns, from life safety, general sanitation, just the minimal need for basic healthy home. And you have a list. If you look at the list, it's pretty common sense. We would expect the house to be rented. We expect the house to have heating and cooling, ventilation, all the safety hazards that we've seen out there. So we've been meeting with landlords. We've been meeting with property owners, representatives, and representation from Realtor Association. We had two different proposals. The main concerns that we got from landlords and from the working group are three things. The first one, why do I need to pay for this if I'm a good landlord? If I am a good landlord, I don't need to pay this. You should target the slumlords or the bad actors. The other one, why you're penalizing me as a good landlord? You should go after the slum lords or the bad actors. And the third one is the time consumed, the time that they have to spend with us. How much time they have to spend with us to complete these inspections. So we submitted two proposals to counter these concerns. The first proposal, which was the main one that we tried to put out there, it's an inspection program to copy many other cities in the country, as I mentioned in the previous map. It consists of an inspection program that will allow us to inspect properties within 36 months. We can increase or decrease the inspection intervals based on conditions of the actual property, compliance, the age of the property, and citations found. This one consists of two different set of fees. The first one is an annual registration fee, and the other one is a permit fees. The permit fees can start for one unit at $90 and can go up to $700 for apartment complexes that have 10,000 plus units. So it's like a fee schedule, and the breakdown of the fee I can provide that on a later meetings, or if you want to email me, I can send that proposal, that fee schedule. After we heard the concerns from landlords, from the working group, we got into a compromise where we can meet them to where to counter all their concerns, and we don't compromise our mission. So we proposed to start with a complaint-driven program. This program will allow us to respond to complaints. Now, the only thing we can do if we receive a complaint from a citizen who live in a rental property, we can provide them with just facts. How can they resolve their problem? How can they, we can provide them with documentation, education, but we cannot take any action. This will allow us to respond to complaints, go on site, complete an investigation. If the complaint is invalid, there is no fee assessed, and complaint is closed. If it's valid, we will work with the landlord and the tenant to fix or to abate citations or violations. If violations are not fixed, then we start going back to re-inspect, and that we'll have to assess additional, or we have to assess fee to complete the re-inspections. This proposal we will be asking landlords and applicants to complete a self-inspection. The City of Independence, they asked to contract a third-party inspection company. In our proposal, we asked the landlords and the property owners to complete, when applying for the permit, to complete a self-inspection. This self-inspection will give us a general idea about the condition of the property, and if there is a need for us to inspect or investigate. So far, where we at with our current proposal, we've been meeting. We've had numerous meetings with stakeholders, with landlords, renters association, and so on. We've been very active with the National League of Cities Mayor Institute. We went last December to Dallas. Mayor James presented on our behalf, and actually this week we will go back to Washington, D.C. to meet with the work group and talk about our proposals and meet with other cities. have something in place that can we benefit from their experience in implementing such an ordinance.
Okay.
Great, thank you.
Other questions, comments?
I might add, Mayor, if I may, and Nasser didn't have this, but we do get calls related to these environmental issues within the household, and there's, I think, the 311 data from last year suggested that there were about 118 calls that we received from residents that we could not respond to because we had limited or no authority to intervene. So it continues to be an issue for that reason. So.
Mr. Mayor. So I appreciate the work you guys have done on this. This is something that is, I think this past winter, we heard a lot of stories, people being without heat, holes in roofs, and I mean, some pretty egregious circumstances. So something needs to be done. I think we had a study just came out recently that said at least half of the housing in Kansas City, or maybe it's in this, are rentals. And that's a lot. So what we're talking about is a very small number of property owners that are not, doing what they're supposed to do. But I'm also mindful of tenants who find themselves that rent in subpar conditions. It's not because they want to, it's because it's an affordable place for them to stay sometimes. And so there's an example in Dallas where they implemented this policy, and then the known bad actor owned a lot of property in a particular low-income area and refused to make the repairs and put everybody out. And so those families were displaced. They're paying, quite a bit more in rent when they had to move. So I just want to be mindful as we move forward with our process, we don't experience some of those same unintended consequences, because when you talk about limited enforcement, we need to figure out what that looks like if we don't really have effective tools to make them comply or resources available to tenants. We've talked about the limited affordable housing units. We don't want to we have to be mindful about what the unintended consequences would be in all this. And so I don't know what the answer will be or if you had that conversation with the landlords, but that would be helpful to have.
Yes, actually, we talked to the working groups about this concern. That's why we limited our inspection to just health-related findings. And what we're looking for the minimum. Minimum, as an example, there's a floor, there's a hole in the floor. All what it takes to fix that, probably $20 a piece of wood, that will fix that. We're not looking for a major renovation for the entire property. The other concern that we had from the work group were the permit fees. Our first proposal was it's a 3 years permit that can go up to $700 for bigger apartment complexes, and it's $90 for 1 unit. Although the way we see it as $90 every 3 years, it's not much, but we eliminated that. We decided to waive that on the second proposal, that there is no permit fee. There is a minimum of $25 annually registration fee, and we don't have an actual permit fee for them to be in compliance.
Well, I think the question that still remains unanswered is how do you really force the landlord to be in compliance? It may be $20, but if they say I'm not going to fix it, then what?
Well, I think if I may, I think the answer is that because of the permit, essentially, if they don't comply when we find an issue or a problem, the permit would then be removed, and like any other business, you just can't operate. So they could say, yeah, I don't want to, if they went so far as in your Dallas example to send someone else out, it's not like anyone else is going to be able to move back in. There's no more income that comes from the property. And so at that point, they can choose to do nothing with it, I suppose.
Well, I think in theory, you guys understand the problem and a way to approach it. Again, that we fall short on the compliance piece. We have a number of businesses that operate without a license in Kansas City, and not enough people to monitor that. When we talk about housing, most of the people that if you screen those calls that came through 311 and the ones that were on the media, they were persons that hadn't been able to rent for a number of different reasons, prior evictions, criminal history, whatever the reason may be, and they're preyed upon. It's predatory. And so those individuals, when they it's not as easy sometimes for them just to go rent somewhere else, is the point I'm making. And so we have to make sure that we have a mechanism in place to really hold the landlord's feet to the fire to make the changes for these people. So having that piece added into this, whether it's something where they end up in municipal court before the judge, the landlord, if they don't comply, something that has some real teeth to it to make sure that these things get done and not just administrative.
Okay, got it. So,
Okay, and the last objective for today is also under housing quality is around energy efficiency and efforts in that area. And so I'll turn it over to Dennis Murphy to talk about this.
I'm Dennis Murphy with the Office of Environmental Quality, and there are a number of energy efficiency programs and policies in place. We wanted to highlight a couple in particular. There's a low-income weatherization program that is funded by utilities that's currently performed by Community Services. And the city, as you've already heard, also operates a minor home repair program. And I think there is a real opportunity of leveraging these two programs and getting a multiplier effect, because one of the reasons sometimes that weatherization doesn't take place at no cost to the homeowner is because it's not viable to do it if you've got a leaking roof. So if we can pair up minor home repair and low-income weatherization, we may get more impact for the benefit of the occupants of those homes. If you look, or if we recall back to the minor home repair program information that Stuart provided, of 179 projects done in 2015, 2016, 101 of those were roof projects, and another 36 were furnace projects. Now, if you then partner that up with making that home that has a secure roof and a new improved furnace with weatherization, then the utility bills for the occupants goes down and they get the real benefits of that furnace upgrade. Otherwise, you're giving them a more energy efficient furnace to heat or a highly inefficient space. And when you look at the average cost being $7,000 per unit for roof repairs and $3,000 for a furnace, you know, we may be missing an opportunity if we don't get weatherization done, if that party is also eligible for that. So it's not as easily done as we'd like, but there's opportunities of marketing both programs so that people that get minor home repairs are made aware of low-income weatherization, and low-income weatherization recipients are also aware of the opportunity for minor home repair. So we think we can get better bang for our buck. You've also heard from the LeadSafe KC work. It also addresses some weatherization benefits. And then finally, I'm going to talk in more detail here in just a minute about PACE programs. That's Property Assessed Clean Energy. That actually helps people who can qualify for loans to get resources for both energy efficiency and solar energy projects. So I'm going to talk about our relatively new residential PACE program. We gave an update back in our earlier KC Stat housing report, but we've got some new numbers to report that look very impressive. So to remind you, in September 2016, the Missouri Clean Energy District, one of the two PACE programs that the city is affiliated with, launched the HERO program, which is a residential PACE loan program operated by Renovate America. That is a company based in California that's been doing residential PACE loans for a number of years and have done, I believe, on the order of $1 to $2 billion in residential PACE loans. They decided to expand outside of California, and Missouri and Florida were the two states that they've moved into. So in 2016, in September, they launched the residential PACE loan program here in Kansas City that makes funding available for both energy efficiency and renewable energy projects. As of June 27th, so that's basically about 9 months, 914 residential loan applications have been received, 545 residential loans have been approved, 255 homes have had completed projects, 426 different improvements made, 358 energy efficiency projects, and 68 residential solar energy installations for a total value of projects completed of $4 million. So we're very, very pleased to see that. And we recently got a request from an organization called the Alliance for a Sustainable Future, which is a joint collaborative between the U.S. Conference of Mayors and the Center for Climate and Energy Solutions, that they would like to highlight Kansas City as a case study in a group of case studies of programs that identify communities across the country that are putting sustainability into practice. So we'll be working on that in the next couple of months. One of the things that I was really pleased to see on the HERO program results was it broken down by council district. And I have to say, I was a little apprehensive that we would not see broad representation across the entire community, but in fact, I was pleasantly surprised to see that a significant number of projects have occurred in all 6 council districts. You can see the representation here, and it's worth noting, I think, that Council District 6, 5, and 3 had the largest number of PACE program loans made. So we were very, very, very pleased to see that result. So the last thing I was going to mention, and I have to admit that the edge has been taken off of this just a bit by the report on the governor's task force on tax credits. But at the time that it happened a couple of weeks ago, I was very pleased to see that in follow-up to the Missouri General Assembly adopting Senate Bill 112, which would have eliminated a provision in the Missouri Energy Efficiency Investment Act that had previously prohibited recipients of low-income housing tax credits and/or historic preservation tax credits from receiving energy efficiency rebates from local utilities, of which we're fortunate that Kansas City Power and Light does offer a lot of energy efficiency rebates to both residential and commercial customers. And the governor had signed that bill. But the flip side is now it looks like there's a very good possibility that low-income housing tax credits and historic preservation tax credits may be reduced or go away. So it may be a bit of a Pyrrhic victory, but we're still hopeful that hopefully the tax credits and the rebates will stay in place that make a significant impact on people that live in low-income housing. Because that's obviously one of the priority goals that we have in this area is not only to focus on residential and housing units, but in particular low-income housing units.
Thank you. Thanks, folks. Appreciate it. Very targeted discussion. I would be interested in the next time that we meet that you come forward with some proposals about not what we already are doing, but what we should be looking towards doing down the road in terms of policy. There may be nothing. We may be doing everything. I don't know, but you guys are the experts. So if there are things going on out there that we're not engaged in and we ought to, the next time that we meet, will you bring those up for us, please? Okay, thank you very much. I have nothing else. Do you have anything else?
No, thanks everybody. I did just want to remind everyone that because this meeting got pushed back into July, we actually have another KC Stat next week on neighborhoods and healthy communities, and there are some really clear ties between some of the subjects we talked about this week and that KC Stat. So you'll maybe see some echoes of some of these issues there as well. So thanks everybody.
Thank you.
Thank you.
Thanks.